Assalamualaikum. My name is Muhammad Amirul Azree Emin from GRM 1102A, and my ID is 2019282574. So right now I want to present and discuss about my topic, which is communication skills between physician insight and parents' perceptions in learning at KSA. By this topic, we want to analyze the communication skills between physicians and patients. There are some survey that has been done, and the data were obtained by a selected group from physicians and parents. According to this survey, there are some different response in this that are given. In terms of the parents' perceptions, they give a lowest mark to a few doctors or physicians because they notice that some physicians lack of communication, and they don't know how to communicate with the patients. So for the next slide, about the introduction of this topic, there are important elements or aspects that the physician have to take a look, which is the verbal and non-verbal contact with a patient. The physicians also must have the abilities to communicate with the patient's parents. Why? Because by this interaction, the physician able to make a good relation with their parents and make them trust with physicians. But there are some countries, especially at the Middle East, such as Arab Saudi, and they are not really take a look serious about these terms, because they think that the communications are really not important for them. So they provide a CAT machines, which mean assessment of tools that evaluate the communicate with the patients. So the people at the Middle East are really not too satisfied with the service that physician give. In addition, the physician have to facing the sensitivity of various of group age. So at that time, the physician have to be smart and make a various communication skills to fulfill the patient needs. So what the objective of this topic? The objective of this topic is to analyze the experience physicians and the perceptions of parents. The physicians have to train their communication skills, because it will make they easier to communicate with the people, especially for their patients, and give the proper communication. So there are some main point that we can discuss by this topic, which is first is a perception of parents to physicians in communication skill with patient. Like I say, there are some parents, especially for a mother, that they are really not to enjoy communicate with the physicians, because sometimes the physicians talk with them that matters that they don't know what the meaning of that. So it will make the patients not it will make the patients uncomfortable. Second is a current result show that confidence in CS among the physicians depends on the years of experience. Of course, because the physicians that have experience, they are really not have a problem to communicate with the patient. They're easy to communicate with them. But the problem is with the practical physicians. Why? Because they are some difficult to communicate with the patient, because they are not used to speak, to communicate with them. So they have to train. They have to train with their senior. Third is a comparison between physician insight and perception of perception parents of physicians' communication skills. Based on the survey, there are 100 female that participate, and most of them are biological mothers. 70% of them disagree, critique to physicians because of their lack of communication with the patients. And the last one is some of high-ranking parents, such as like a VIP, affect their level of satisfaction with their physicians, such as they fussy with their environment, such as the facility, the service, and others. So when this happens, it will make the physicians lose their confidence, and it will make them hard to communicate with the patient. So the conclusion of this topic is the KSA have to take a look and serious with the problems and solve as soon as possible. Why? Because it will decrease their reputation of KSA. So my suggestion is KSA have to train their physicians. It doesn't matter the physician has experience or not, they have to train, because it will help them to communicate with people and also to increase the KSA reputations. So that's all for discussion for my topic, and my partner will continue with their article.
Hello and Assalamualaikum. My name is Muhammad Emin Muammar bin Zulihan. Today I want to present to you about my research on the article review. The title of my article is Science Communication is Needed to Inform Risk Perception and Action of Stakeholders. Okay, first I want to explain with you about about the abstract part in this article. In this abstract part, this article shows us that the stakeholders was a critical environmental manager in health in human-dominated landscape. In other words, only the stakeholder has the authority to personally act following their own observation and risk perception instead of science communication. However, the biological invasion need to require to tight controls in order to prevent unwanted things from happening, such as biodiversity losses and species extinction. Biological invention is very important to reduce potential socio-ecological impact, while science-based risk assessment are rather complex and time delayed. After that, based on the research in Western Europe, beekeepers controlling the invasive Asian hornet, which is called Vespa velutina nigritorex, or Asian bees, for its suspected impact on honey bees colony. They analyze mechanism underlying personal action of stakeholders on how they evolve in science. However, personal action that has been taken by the stakeholder are because of the consequences that happen based on their observation and research results. Unfortunately, the action does not connected to science give to bad impact or results on numerous species of the local entomofauna. Okay, next I want to explain about the introduction part in this article. Based on the introduction part in this article, we can understand that the stakeholder can be concluded as an environmental manager who affected by decision and action that they take, and they also have the power and authority to change action. As we all know, biological invasion left a negative impact on worldwide, such as biodiversity loss and species extinction that may threaten economy and public health. So, the stakeholder needs to find a way to prevent the causes. So, they have implied the 3 ways to prevent it, which is preventing the invasion from occurring. First step is reducing the impact magnitude or repairing the damage, for example, like restoration program. This program requires all the stakeholders to work together in order to make this happen. After that, it tells us that risk perception is determined by different social and environmental factors affecting individual. Risk perception consists in the importance that individuals give to an at-risk situation. Based on the case of humans, someone's perceptions of an environmental risk will vary according to their relation to nature. But the different case is based on the different perceptions. Not all the perception is the same. Based on their study on Western Europe, European beekeeper controlling the invasive of Asian hornet, or Vespa velutina nigritorex, or which is a famous name is a yellow-legged hornet, for its suspected impact to their professional activity. This species is rapidly increases across most of the French territory. Based on this study also, they concluded that Asian hornet catches foraging western honeybees at the beehive entrance during the critical pre-wintering season for honeybee colonies, and therefore may represent an additional risk factor involved in the winter mortality of currently weekend bee colony. Based on the research also, western honeybees are currently suffering collapse disorder, and this scenario need to be addressed immediately. So they take the opportunity to figure it out and increase the quality of honeybees in Western Europe. They have choose a safety step, which is the use of passive threat with homemade syrup or poison with insectical bait was the most effective way that has been used to control the invasive of Asian hornet. Therefore, Western Europeans had followed their observation or research about a perception on Asian hornet, and they have do some tests to improve it for a better ways. And last is they also make a discussion about a way to avoid unwanted things from happening again. Okay, we move to the objective part in this article. The objective in this article is firstly they want to prevent a biological invasive from happen. So they need to find a ways and effective alternative to avoid it from happen. The stakeholder also need to pay an attention on this scenario. They are also responsible to avoid the biological invention in their country or district. This program need a lot of paperwork to do. Based on their research, they have find a way to prevent a biological invention. There are a lot of negative impact if biological invention happen, such as like I told before, such as the negative impact is such as biodiversity losses and species extinction. So the management has established the policy following scientific risk assessment recommendation and prior to stakeholders' opinion-based action. The choice of the management plan depends on the invention stage and the results from risk assessment studies. Nevertheless, assessing the potential risk of a newly introduced alien species is extremely complex and time-consuming. It depends on a combination of co-evolutionary processes. Population dynamics, such as population dynamics, complex interspecific relationship, abiotic changes, and anthropogenic impact. So, the main objective in this article is to fight biological invention that will threaten a world, especially public. In this paragraph, they also implemented a science program at a national scale to record its invention range, which is effective way to protect bad things from happen. So, a web platform has been created by the French National Museum of National History that inviting people to register the observation associated with a picture to prove the identity of Asian hornet and the location of the observation. Okay, we move to the discussion part in this article. Okay, back to this article, they had mentioned about the biological invention that occurred in Western Europe, which is the Asian hornet. They want to control the invasive of Asian hornet in the Western Europe. So, the responsible party or stakeholder should take an effective steps to address the problem, which is to improve the quality of honeybee and how to take care of it. For example, they use the mechanism such as beehive model to address the risk of or probability of honeybee colony mortality related to Asian hornet production. But their purpose is to control this invention has a many perception and opinion from different individuals. Such as I said before, individual has not have a same perception. They have a different opinion and decisions. Individuals' opinion and perceptions are not the same. Okay. In this discussion part, they have told us before that they have implemented a way or an alternative to prevent the invasive of Acid Hornet. So they have used the way as they created the model that was calibrated following the Becher et al., which is the foundation's which is that foundation's name. In 2014, initial colony settings for which 4 key colony parameters were modified to increase the stochasticity is the prediction and to improve representatives of real field condition variability. They also stated that this action have a risk and they need to consider that science communications is related to inform risk perception and action of stakeholders. They want us to understand that science communication is need to be considered or is a very need to inform the risk perception and action of our stakeholders. Last, the most important element that they have discussed in this article is the stakeholders had to manage the environment in human-dominated landscape, ideally following management plans that were previously established by science-based environmental policies. So, along with this, they had shown that the beekeeper has their own personally act that they can use in order to follow their observation and risk perception instead of following the scientific recommendation that were time delayed. The action that they take has a risk, so that they have to manage and think carefully to make a decision, especially if the problems is serious, just like the biological invention that have a lot of negative impact. Last is the conclusion part. In this conclusion part, they had discussed about the biological invasion that occurred in Western Europe, which is the Acid Hornet scenario. They want to control the invasive of Acid Hornet in the Western Europe. So, the responsible party or a stakeholder should take an effective step to address the problem, which is to improve the quality of honey and how to take care of it. However, their result help them fill a knowledge gap regarding how personal actions of stakeholders evolve in science disconnected context. In particularly, their result provide evidence that mutual communication between stakeholders and researchers do before, during, and after the risk assessment process is one component that needs to be reinforced to ensure its usefulness for biological invention management and policies. Last but not least, involving stakeholders in invention management programs is central not only ensure their success but also can enhance their acceptability and avoid situation where such program result from a single action evolve. Okay, that's all from me. Thank you.